Hey everybody, welcome to our video today. Today we're talking about navigating a serious illness as a veteran, and I'm really grateful to have Brian Thompson join us to share his story, and Dr. Eric Bush, who's the Chief Medical Officer for Hospice of the Chesapeake and Chesapeake Supportive Care. So thank you guys both for taking some time this afternoon to talk.
Thank you.
My pleasure.
So Brian, let's start with you. I really want you to share, if you would, a little bit about your journey. First of all, thank you for your service as a veteran. I just want to say thank you for that. I'm grateful for that.
Well, thank you for those sentiments, and it was my pleasure to serve. You know, I'm a very proud veteran.
Can you start with that piece a little bit about your life? Like, what branch of military did you serve in? Talk to me a little bit about your service.
Okay, well, I started in served in, I should say, in the United States Navy, and I enlisted back in 1989 and served for 10 years.
Wow.
I was at a number of duty stations. My primary duty was meteorology and oceanography.
Okay.
My title was called areographer's mate.
Wow.
So, you know, basically we provided the weather for our land station or whatever ship we were assigned to.
That's cool. That's very
cool. Yeah, I think so. You know, it was very interesting. You know, growing up in school, I never thought I would be a weatherman.
Yeah.
Know? But then I looked at it and it's like, you know what, that seems pretty interesting. And I decided to take a shot at it, and I liked it, you know.
So talk to me a little bit more about yourself, about sort of, so why we're here today is really to talk about your health,
Okay.
and sort of how that plays in part with your, as a veteran, what that's kind of, how that's gone together. So if you don't mind, if you would share a little bit about your health journey with me, about what's been going on for you.
Okay, well, back in 2012, I began having some chest pains and things of that nature. And I thought it was related to my heart, you know. So I started going to a cardiologist, and he was like, your heart's fine. And, you know, but every once in a while I start losing my breath and had to sit down and things of that nature. And one day I thought I was actually having a heart attack. And so my wife rushed home, and we went to the ER, and they said, no, well, but you EKG came back normal. And they said, well, you got some kind of fluffy stuff. That's what they described to me.
Fluffy
stuff in your lungs area, you know, on the periphery of your lungs. So I followed up with a pulmonologist, and he monitored me for almost a year. After my last CAT scan, that mass grew, so they wanted to go in and do a lower wedge lobectomy, where they would actually take out samples or like remove part of my lower left lung. And they described it to me as it being not too evasive, but it turned out that it was very invasive. And once the thoracic surgeon opened me up, he saw that, hey, you got this cancer, you know. So, like, long short of it, I was doing chemotherapy within like 2 weeks of the surgery.
This is all back, Brian, this is all back in 2012?
Well, it was 2013 of August. Okay. So, because I started seeing the pulmonologist in the fall of 2012. So it was about 10 months of going and, you know, regular checkups every couple of months with my pulmonologist, doing CAT scans. And one month we'd do CAT scan and wait 2 months and then do another CAT scan. And then 2 months later, we did a biopsy. And then 2 months later, we did another CAT scan. And then that last CAT scan was like, whoa, you know, this is growing. So that's when they wanted to do the lower wedge lobectomy to like remove it or send it off for testing, but the
Right.
thoracic surgeon was like, I can't remove anything other than getting a quick biopsy because it had spread so much around my lungs.
At,
And then
at
I
what
started
at what point did they give you a diagnosis, like the stage?
that state that day. It was, on that day, it was that I call that my new birthday, if you will.
Okay.
August 29th, 2013.
Okay.
Uh,
And at that point, what did they tell you? What was the staging and
it
the?
was stage 4 non-small cell lung cancer.
Okay.
So that really, at the time I was 43, and they was like, well, you're not supposed to have, all the doctor, you're too young, So I was like, well, being that, give me everything that I can handle because I'm a bigger guy, and so they did, and they through the whole gamut, based on safety,
Right.
uh, and it stalled it out, which was great, So then I went down to Hopkins, and in the meantime, I met, sorry, Dr. Bush.
I was just
I
gonna
met
I was
Dr.
gonna
Bush
jump
in the
in and be like,
meantime.
okay,
Why was when I first started the chemo, they was like, because at the time, the doctors, all of them were saying, hey, how you're going to beat this is up here. They said we can give you all the medicine that technology provides, but you have to have a positive mindset. And I believe that halfway. Because people were saying 18, 12 to 18 months. That's what they gave me.
okay.
So I walked into his office, and of course I was a mess, and because I thought, all right, well, am I going to live a month? Am I going to live 6 months? I really didn't know. So, but Dr. Bush was great, to me and my whole family, and he really just put my mind at ease. I began seeing him monthly, ask me if I had any pain. Initially he gave me pain meds, post-op, and my post-op, it was, I still feel residual pain in my chest area from time to time in my back, and Dr. Bush is there, that is one side of it. But the main thing for me is he helped me up here in my mind, and I began seeing him for, every once a month, and it was like giving me that energy to continue. It's like, okay, I'll see you next month. Okay, I'll see you next month. And it was like recharge my battery, if you will. I had my, my support family and friends, and, but after a while, a year or two going into it, people start getting back into their normal phase of life, and, no one checking on, no one cooking for me anymore. It's like that kind of thing, it's like, I think that's how I gained all this weight anyway, people dropping off meals and things of that nature, so I continue to see him. I travel, in non-pandemic state. I travel to his office, once a month, once every other month. It's, we could do this. We could have been doing this all along. And hey, I need a new, renew my prescription for this and that and the other. But I wanted to, see him face to face, to continue to recharge my battery, if you will. I talk to him about everything, all phases of life.
Yeah.
Sports, family issues,
relationships.
Yeah, relationships, everything. And I trust what he says, and and I value what he says to me.
Thank you.
Yeah.
Thank you.
Dr. Bush, did you want to add anything about sort of your journey of working with Bryan from the doc perspective?
Yeah, and he hit the nail right on it. So, number one, first and foremost, I consider him a friend and someone that, I just want to help immensely. I first got called to see him when he had just had his surgery for his cancer. And when I was reading through his chart, I felt for him immediately because it seemed like it took so long for everybody to get their ducks in a row in order to get a diagnosis just to begin with.
Yeah.
And I think, that's something we can talk about in a minute with regards to just, validation. And a lot of times, especially being a younger guy and being a veteran and looking okay physically, people kind of say, oh, well, you're okay. It'll be okay. And here you are, then you have a new stage 4 cancer diagnosis. And there's times, like Bryan said, times it's been pain management, times it's been, talking about just the challenge that an illness like this can be, that it's chronic. So it's a marathon. It's not a sprint. You start out as a sprint, but then you say, okay, I got to pace myself. And the things that he talks about with regards to, people falling off, those are things that I see. A lot of times you see somebody get acutely ill and everybody rallies around them. And then a month, 2 months, a year later, and you're like, hey, where did everybody go? And those supports are so important. Right. And he's got a phenomenal family. His wife and his son are, awesome. His wife advocates for him and is such a strong advocate. And even though I'm not physically at his health system anymore, again, he travels to see me with the telemedicine, with the pandemic, and he knows and his wife knows that they can call me anytime, day or night, 24/7. If something were to pop up, an emergency, I'm going to be there for them. And I appreciate that he pays it forward. One of the things he and I talk about is paying it forward and how can we help other people. And that's, part of what today grew out of is how can we raise awareness and make sure that people get the help that they need when they need it and understand the resources that are out there for them.
Yeah, I think you brought up, both of you brought up a couple of really good points about, first of all, the marathon, not a sprint.
Yeah.
At the beginning part of your journey, it sounded like, you're bombarded with a lot of information. It's a lot of like, yeah, right now. But then continuously living with that, it's just, you need the support to recharge your batteries. Like you said, Bryan, it's just an important piece of the healthcare puzzle that I think a lot of people aren't aware of.
Right.
Bryan, if you could talk specifically about some of the challenges as a veteran that and we touched on it before we started recording about the medication piece even, but there are pieces, I'm guessing, as a veteran with navigating a serious illness, like what are some of those challenges specifically?
Well, specifically, where I reside is an hour away from my services for the VA, a hospital. I have an outpatient clinic here in Fort Detrick, and that's my, if I get a cold or something like that. But like if for something this serious, I have to travel to Martinsburg, West Virginia, or inner city Baltimore, inner city Washington D.C. at Walter Reed, and that kind of physical challenge in itself is and then trying to build a relationship with oncologists, and as we all know, a lot of the VA hospitals are overrun, understaffed, but they're on a good track of improvement in that manner. Especially, I chose to go to the one in Martinsburg because it's kind of against the traffic pattern.
Okay.
That it doesn't take me as long, and there's not as much foot traffic in that manner. But to talk about the the current medication that I'm taking is provided through the VA, and it's a 30-day supply. In the beginning, I've been taking this medication since 2015 after they did another analysis of my original biopsy, and it was determined that I was eligible for immunotherapy, which is still chemo, but it's taken orally. I mean, and then, of course, this is back in 2015. Now you see, anywhere from there was 1 or 2 back then, but now it's, probably 7 or 8 immunotherapies that we see, commercials for on TV and that nature. But because the VA is providing me with this meds, I have to travel. I have to have an oncologist on board with the VA, and she works very well with my oncologist here in town. And she's like, basically, whatever I agree, whatever they say, I'm in agreement with. So getting that prescription sometimes is like a little bit of a challenge because of, I don't know, somebody at the pharmacy maybe dropped the ball or not having such a good day. And, there have been a few times where I've had to drive out there to pick it up because I didn't trust the mailing system at that time, where I needed it like ASAP. So, other than that, it's as far as the VA goes, I'm more in tune with my local oncologist, and we meet every 3 months versus I meet with my oncologist and with the VA every 6 months. So, it's we have a relationship, but it's not as high detail with my local oncologist.
Yeah. It sounds like just additional hurdles on top of a challenge already. And
yeah. And just having to, say, okay, I bite the bullet, if you will, like kind of, all right, it is what it is. I'm more of a nature person to, like, if I can't control it, I'm not going to sit around and, wear myself to death about it.
Right.
On the other hand, I have someone that does that for me, if you will, that my advocate, my loving wife, Amy, she's the worrywart. I say that not in a negative sense at all. She,
right.
If I didn't have her, I probably wouldn't be sitting here right now.
Right.
And that's a definite, because even things that she doesn't know much about, she does the research for it, and lo and behold, she becomes a quick expert in that regard. And I'm like, well, okay, great, awesome. So
it's good to have somebody advocate for you and be in your corner and just sort of, yes. I mean, I think that's, a gift to have somebody be able
a blessing, definite blessing.
Absolutely. Yeah. Dr. Bush, you alluded to this a little bit, but and wanting to see if you guys could talk about this a little bit more, about the topic of when someone is sick but doesn't look like it.
Yeah. So that's something that Bryan and I talk about a lot, and just it's hard because, and he's not the only patient that I have that encounters this challenge. It tends to be patients that are younger and patients also that have cancer that have good functional status, are out there trying to live their life, live good quality as well as quantity. And unfortunately, they often get dismissed. So Bryan, did you want to talk a little bit about, some of our discussions about that?
That I live that like every day. People look at me like, really? You have cancer? I'm like, yes. like, oh, what stage? Stage 4, you know, and they're, wow, I didn't know that. But previous, you know, I know I've had previous conversations with said other person, and it's like, I mean, I could feel for them in a sense that, well, I do look like quote unquote normal, you know, healthy person, and you could, you know, you could quickly forget about it. But sometimes it's rough for me. It's like the expectations, you know, of like, you're fine, you know, you can do that, and then when I can't, it's sometimes looked upon as me being, you know, not caring or lazy, if you will, or, you know, that kind of thing. And it's like, wow, you know, like physical, like sometimes I have physical limitations during the day, and then other times I have mental limitations during the day that are challenging, you know, not wanting to like go out in public or, you know, do things around the house because my mental state is like, I can't be around anyone, you know, don't want to be, you know, no one wants to be around someone that's sad, if you will, you know. So, but like with Dr. Bush, he's helped me, like our conversations, you know, I talk about being depressed, having anxiety, um, because of my physical limitations, you know, and I used to be very active in sports and coaching and, you know, actually playing, you know, different sports, you know, and when this came about, I didn't have the energy to continue to do those things that I love, you know.
I appreciate it, because it's not just, unfortunately, you know, as you know, Brian, it's not just a challenge for you, even with people out in the community. It's a challenge even sometimes with other healthcare providers, and it's maddening to me. You know, it's almost like I have to show them your chart and say, hey, look, yeah, this is what's going on with this guy, and I need your help to try to help him out. So it's a validation issue, it's a bias issue. I mean, on multiple levels, it's such a huge challenge. It shouldn't be that way.
Right. Right. And I mean, I try to, I mean, and I don't want people to pity me, you know. It's like, I'm good. Like, if I say I'm good, I'm good, you know. But like, so at sometimes, I mean, that could switch up from sometimes from hour to hour, or, you know, from day to day, you know. But if I say I'm good, then I may not hear from that person for a couple of weeks, or, you know, or 3 weeks. And sometimes, and that's frustrating, you know. It's like, oh, man, I could really use some support from over here, or, you know. And I know I'm not the, you know, I've always been a, you know, to myself kind of person, you know, not having a lot of friends and things of that nature. But then when this occurred, like, everybody just came out of the woodworks, and I was like, oh wow, this is awesome. I have, like, I've become reacquainted with someone that, you know, I hadn't been acquainted with in a while, and then a year later it's right back to where we were before.
Are there any other, Dr. Bush, I'll probably just direct this to you, unique needs that you think should be brought up and people made aware of when someone is a veteran who's facing, and Brian, you can chime in if any of what Dr. Bush says kind of resonates with you.
Sure. So number one, I think about, you know, volume. People don't realize that at this point in time, approximately 54,000 veterans die each month in this country. They account for about 1/4 of all U.S. deaths. a lot of times, given the prior experience and what they've done and had to do, there's behavioral health, mental health, as well as the family, who have often made a lot of sacrifices. And so I think in approaching veterans, again, that being said, you have to approach each veteran uniquely and independently, just as you would any other patient. Start off with some simple questions such as, are you a veteran? Tell me about your experience. What branch were they in? When did they serve? Because a lot of those things have to do, from a generational perspective, differentiating the needs. So i.e. Gulf War versus, say, Vietnam era. And then you can get into some more detailed questions if you have permission and you're able to establish that relationship, such as highest rank, were they enlisted or an officer, did they receive care, have they received care at the VA, are they service connected, if they've tried to be service connected, which sometimes can be a challenge, as Brian was saying.
Right.
I think the VA has, from a overall resource perspective, tried to put more resources out there. But as Brian was saying, access sometimes just geographically and otherwise can be a real challenge. The VA does allow for concurrent care, which is good. So both for palliative care as well as hospice, veterans can get, curative as well as comfort-focused care simultaneously, and they will pay for that. One of the things I'm proud of is that here in my role with hospice at Chesapeake, we've actually served close to 2,000 veterans in the last 3 years, which is amazing. We're a level 5 We Honor Veterans program, which means we do additional training annually for veterans, and we're one of only 36 programs in the country to do that. But again, I think our veterans deserve, that kind of quality care that comes along with that.
Right.
And those are just some general thoughts. Brian, do you have anything else you'd
think
like
the
to?
overall sentiment, as far as veterans, from a veteran's mindset, like, you get out of your respective service, and you go out into you try your best to get out in the workforce. If you're fortunate to do that, you forget about that that you are a former service member, and because that advocacy isn't there, as far as, hey, we can help you, whether it be physically or, or mentally, I think that piece is lost. Like, it's missing a step, like where promotion of those services, whether it be with the VA or whether it be at, another service provider, so I think that piece, especially, if someone's, fairly young, getting out, if they only did one tour, 3 or 4 years, however, they're still a veteran, and not knowing that services are readily available for you, whether it be with the VA or somewhere else. It's limited, as far as those services putting out enough information.
So the communication piece that, like what you're saying, is there's a gap with that. Yeah.
It's I think it's a pretty large gap, because and that's one of the main reasons why I still wear my dog tags, and I let them be shown, and and just by having that, people come up to me, thank you for your service, and then may elaborate, yeah, I served as well, and and they ask me questions, and I try to provide answers as much as I can, especially for the younger generation, are like, hey, you don't have to, act like, try to be a superwoman or Superman. There are services out there that that are there for you. So, it's near and dear to my heart, but also I want to let people know that I encounter, hey, if you have a question, I can, try to provide answer for you or send you in the right direction. I have veteran decals on both of my vehicles, and just to let them know, hey, if you have a question, come ask me, because like I said, I think that's the missing piece. Like, once they get to where they're going, the services are great, but they just don't know that they're there.
Right.
So,
yeah.
Dr. Bush, did you have anything else you wanted to add to that?
No, I think Brian's thinking along the right lines. Absolutely. I think there's a communication, education, as well as an access piece.
Right.
And I think once you're in the system, so to speak, those resources are there, but getting to access it or even knowing that they're available to you, that's really the challenge.
And Dr. Bush, I failed to mention a thank you to you as well for your service. I should acknowledge that as well.
Sure. Yeah.
Did you guys ever talk about that? Like, did you all both know that you served?
I think briefly.
Okay.
Maybe briefly in the beginning, but like Dr. Bush is like, it's all about me.
I was going to say, I'm guessing he probably.
We've shared, family, relations, and outings and things of that nature.
Right.
So.
Yeah. And Brian's right, just briefly, and I think it's because we love each other, but he's a Navy guy, I was an Army guy, so.
So you don't get into it too deeply.
No,
I'm just kidding.
My dad was Air Force. My brother and sister were both Army, so I chose Navy.
Yeah.
Well, you guys,
did great, my friend. Yeah.
Thank you both again
Thanks.
for taking time to talk with me. And Brian, thank you for sharing your story. I think it can be very, very helpful for a lot of people.
Yeah.
It was my pleasure. Definitely.
I also want to be sure to thank the John and Kathy Belcher Institute for their generous support of the community education programs at Hospice of the Chesapeake. Thanks.